it connects with the shoulder joint complex and it connects with the elbow joint. The humerus, it articulates with a part of the scapula who makes this shoulder joint. This humerus, it articulates with the part of ulna who makes the elbow. That's the reason why he acts as a connector between these two joints and the part of the upper. This is what you are going to read today about the. In the first of the osteology class, I told you people that you need to read in a particular format. And the particular format, what was the first point? Anatomical position. That means how I will hold the bone. The first point. What I told, this humerus is supposed to articulate with a part of the scapula. How the scapula is, to hold the scapula, this is the position of the scapula and it sits on the back of your thoracic cavity. And এই যে বোনটা তোমাদের সবার পিঠের পেছনের দিকে আছে. And this bone, it is to articulate like this. Now today, as a first topic, the first part of the humeral osteology, that is how I will hold the bone. That means what is the anatomical position of this bone. To understand the anatomical position of this bone, first you need to understand few points. Among that, the first point is which is the superior, which is the inferior. যখনই কোনো long bone করবে, the time you will read the long bones, first you need to understand কোনটা উপরে কোনটা নিচে, which is superior, which is inferior. তারপরে যেটা করবে, the next point you will read কোনটা সামনে কোনটা পেছনের দিকে, that means which is anterior, which is posterior. So which is superior? By seeing this, am I holding this bone in a proper way? No, it's ulta. That means this is the proper way to understand this bone, because this is the superior aspect and this is the inferior aspect. This the superior, why you are telling? Because this is called as a head of humerus. Humeration matha. This is the head of the humerus. And this articulates with the scapula. See, this is the superior aspect. This is the inferior aspect. That means I will hold this bone in this position. I will not hold this bone in this position. So that is the first point of the anatomical position of a bone. All of you got it? The second point. Now I will understand which is the anterior and which is the posterior. You people got it that this is the superior, this is the inferior. Now I might hold this bone in this way. I might hold this bone in this way. Then which one is right? Which one is correct? To understand that, see, I am holding this bone. This is the superior. This is the inferior. I might hold this bone in this way. I might hold this bone in this way. Which one is anterior? Which one is posterior? To understand that, on the posterior aspect of the lower end of the humerus, there is a big groove. There is a big groove, and that groove is named as olecranon groove. Groove কথার মানে হলো it is a hollow space, একটা খালি জায়গা. And that hollow space, it's for the articulation of the ulna. You see, there is a olecranon process. This part, it articulates with the olecranon groove, and that is how your elbow joint is moving like this. So if I hold this bone in this way, is it right? No. So this is which aspect? Very good. This is the posterior aspect. Then which is the anterior aspect? This is the anterior aspect. So first point we understood which is superior, which is inferior. Second point we understood this groove, this olecranon groove, supposed to be on the posterior aspect, not in the anterior aspect. That is the second point of understanding which is the anterior, which is the posterior. Now there is few more points to understand. In the humeral head, this is called as a head. In the humeral head, there is two bony prominences. These all are named as tubercle. Tubercle. These two, it's named as tubercle. This tubercle or tubercity, it's another name. This tubercle and the tubercity, it's supposed to be on the anterior aspect and it's supposed not to be in the posterior aspect. মানে কি আমি যদি এই বোনটাকে সামনে থেকে দেখি, if I see this bone from the anterior, I will see these two bony prominences. তার মানে আমি বোনটাকে কিভাবে ধরবো? Again, I will hold this bone in this way so that these two bony prominences is very important. The time you will go in the depth of this bone, you will understand how important it is. These two bony prominences is supposed to be anterior side. So can I hold this bone like this? No. So we understood the third point, that this is anterior, this is posterior. Clear? Once more, shall I repeat? Okay. Once more, I will repeat. This groove in the lower and posterior, but the tubercle is supposed to be in the anterior. Clear? So once more, I will repeat. We are reading the anatomical position of this bone. This is the superior, this is the inferior. Via seeing this bone only, you can tell that which is superior and which is inferior. Don't hold this bone like this and tell that this is the superior, this is the inferior. Then go on. Examiner will not ask you any further question. He will understand. It's okay. So this is the superior, this is the inferior. This is the head of the humerus. This is called as a upper end. This is called as a lower end. মানে এটা উপরের দিক, এটা নিচের দিক. And this is called as a sac. This upper end will have two tubercles on the anterior aspect, and the lower end will have a groove. That's what's called as a olecranon groove on the posterior aspect. So that's what you first need to understand, the anatomical position of this bone. There is one more important point, although it is not that much important. If you see this, there is one more important point. On the anterior aspect, there is a spiral line, but the posterior aspect is quite flat. The time you will read the surface and the border, you will understand. On the anterior aspect, there is a spiral line, and the posterior aspect, it is bit flat in comparison to the anterior surface. That's the another point. That spiral line is supposed to be more anterior laterally. That is the last point to understand about the anatomical position of this bone. So by this, you will understand what is the position of the bone. But yet I am holding, jara ager dine koyekjon pashe class amake জিজ্ঞেস করছিলে, so yet I am holding the bone in my two hands. Yet I not decided which side it is, right? So yet it is in my mind, I am taking the time from the examiner to understand which side it is. That's the tics. Okay. So yet I am holding these two bone and describing this is the superior, this is the inferior, this is the tubercle, this is supposed to be the anterior, this is supposed to be the posterior. But yet I not changed my hand. আমি কিন্তু এখন আমার হাত চেঞ্জ করিনি, মানে আমি কিন্তু ডান হাত বা বাঁ হাত এখনো ছাড়িনি, তার মানে আমি এখনো এক্সামিনারকে বলিনি এটা কোন সাইডের বোন. That's how you need to take the time from the examiner instead of পড়েছিলাম স্যার কিন্তু ভুলে গেছি. Instead of that, take the time from the examiner, giving the time before that, telling which side it is. Now I need to decide this is the right side bone or the left side bone. That's what the point is called as a কি বলে পয়েন্ট আছে side determination. That means this bone supposed to be the right side bone or this supposed to be the left side bone. কেউ অ্যানসার করবে না, ভাবতে থাকো. এই বোনটাই আমি হাতে ধরে আছি, নিজের মনের মধ্যে ভাবতে থাকো which side it can be. But don't give a vague answer. How to give the answer anatomically is what I told. This is the scapula. এই যে মুখটা, this is the articulation for the humerus. এই হেডটা এখানে বসে আর তুমি যে হাতটা এরকম ভাবে তুলছো, this head is to move like this. And that's the reason this is called as a ball and socket joint. This is the ball, this is the socket. That's the reason why this joint is called as a ball and the socket variety. Clear? Now I will keep the scapula one on this side. Again I'll keep the scapula on this side. So this is the which side scapula? Left side scapula. I'll keep the scapula on this side. Now I might hold the bone on my right hand because you know this is the anterior surface, right? So this is the anterior surface. Now also this is the anterior surface, this is the posterior surface, right? This is the anterior, this is the posterior. So I might hold the bone in this way, I might hold the bone in this way, but I have to hold the bone in this position because this is the anterior. I cannot do like this, right? So I am holding this bone, one on the right side, one on the left side. Now you think and give the answer that if I hold the bone on the left side, is it right? Or if I hold the bone on the right side, it is right. All of you telling this is the left side. Anyone with the support of right? No, it cannot be. Why? The first reason is, if I hold the right side, see, the ball of the humerus is going outward. But remember, the ball of the humerus is supposed to be inward. So, with a simple example, simple reasoning, you will understand. This is the left side. Reasoning is the head of the ball of the humerus supposed to be projected medially, not laterally. What is the meaning of this word? Projected medially, not laterally means, if I hold this bone in the anatomical position and this is the anterior, this is the posterior, this head supposed to be towards your inner of the body. It's supposed to be inside, not the head supposed to be like this. So the head supposed to be towards the medial. That is the reason. This is the which side bone? Left side. So that's the time. That time I will determine that this is the left side bone. What I will do? I will leave my right hand. So আমি এখন decided that it's the left side. I will leave my right hand and I'll hold the bone in the left side, keeping in the anatomical position how the bone supposed to be. Why this is? Because it will give a clear picture for you to understand to describe the bony prominences. মানে তুমি কিভাবে বোনটা ধরবে এক্সামিনারের সামনে, you will hold the bones like this and you will keep like this. Now you will describe, sir, this is this, this is this. মানে তুমি নিজের দিকে ঘুরিয়ে বাহ কি সুন্দর. So don't do that. You need to hold the bone to facing the examiner because the examiner will be sitting in front of you and you need to face the anterior portion towards the examiner and you need to describe like this. You can hold a pen and you can describe that this is the bony prominence, this is the head, this is the shape, like that you need to describe. So this is the second point we read. First is the anatomical position and the second one is the side determination. The third point. What is the third point? What is the third point? Is the ossification. Ossification means how the bone will grow up. Ossification for this particular bone is having both primary and secondary ossification centers. Once more to repeat, this bone will have a primary ossification center and again this bone will have a secondary ossification center. Normally, the humeral ossification, there is one primary ossification center, and 7 secondary ossification center. আবার আমি রিপিট করছি, for a particular humeral bone there is one primary ossification center. There is total 7 secondary ossification center. One primary and total 7 secondary. Few more things you need to remember. Among that 7 secondary ossification center, there are 4 in the head. There are 3 in the lower end. বুঝতে পারলে না? No. One primary ossification, 7 secondary ossification. Among that 7 secondary ossification, 4 in the upper end, 3 in the lower end. মানে যত তুমি বড় হচ্ছ, এই 4টে ossification center upper end কে বড় করছে. These 3 ossification center making elongating the lower end of the humerus. So that is the primary and the secondary ossification centers. What is the age of the ossification? দুটো পয়েন্ট করতে হয় যে কটা ossification আছে আর what is the age of the ossification. Normally the primary ossification for this humerus, it starts from the 8th month of the intrauterine life. 8th month of the intrauterine life. And the secondary ossification center, it starts from the 3rd and the 5th year of the age. 3 এবং 5তম বছর থেকে secondary ossification center কিন্তু শুরু হয়. It ends at the age of 20. 20 বছর বয়সে গিয়ে the secondary ossification center ends up. That is the ossification centers of this particular humerus. Once more, I will repeat. The humerus, it is having mainly 2 type of ossification center, primary and secondary. Primary আমরা কোনগুলোকে বলি? That is from the young age, in the intrauterine age. যখন বাচ্চাটা উম্পসের মধ্যে. That's the time what is called as a primary ossification center. It starts from the 8th month of the intrauterine life. কখন গিয়ে শেষ হচ্ছে? It ends up with the 3 to 5 years. যখনই শেষ হচ্ছে the secondary ossification center starts. কখন থেকে শুরু হলো? From the 3rd and the 5th year of the 5th year of the age, when it will end up at the age of 20. That is the ossification center for this particular humerus.
Like the secondary ones, you said 4 of them are at the superior part
and 3 are the inferior.
For primary,
no, primary it is in the whole bone. The time there is a primary, there is a no, the shape of the bone it was not like this. That means when the child is very small or age of 2 months, 3 months, they don't have the shape of the same like of the humerus. The time the child is growing, all the bony prominences is coming in a shape. That is what exactly the part of the ossification. Ossification means when exactly your bone will have a proper shape. That's what is called as the ossification. Now we will a little more part we will read, that is the parts of this humerus. Then we will go with the another class with the bony prominence and the surfaces.
Secondary ossification start with the 3rd and 5th year. Categorization of the upper end is not here to
upper end, 3rd and 5th মানে হচ্ছে upper end, the superior part of the যেগুলো যে primary ossification secondary ossification centers গুলো superior থেকে they start from the age of 3. Lower end it starts from the ossification center of the 5. সেই জন্য 3 and 5 বলা হচ্ছে. Clear? Anyone? Any more doubt? Then one more little more part we will read today. That is about the main bony prominences and the parts of the humerus. Main bony prominences and the parts of humerus. The time you will hold this bone in this position, you need to tell to the examiner that humerus is having a 3 part. The first one, this is called as a head. This is called as a neck. This is called as a sac. And also the sac is having a lower end. Head, a small neck. This part is very important because the surgeon is to cut this part for the surgery. Each and every bony prominence of a bone is having its medical value. This is the head. This is the neck. This the long area is the septum. This is the lower end. This is how the whole bone is divided. Once more, head, neck, septum, lower end. Necker পর থেকে. In a simple way, our whole body is the same. That's what's out for the bone. This is the head, this is the neck, আর আমার পায়ের পাতাগুলো হচ্ছে that's the lower end. To make it more easy. Now, I told this is the head. This ball type of structure is the head. This line is the neck. For a humerus, there is two type of neck. One is called as anatomical neck, and the second one is the surgical neck. Although there is something is called as a morphological neck, not needed as of now. অতটা দেখতে দরকার নেই. So as of you will understand, there is a two type of neck. One is the anatomical neck, and the second one is the surgical neck. নামটা শুনেই কিন্তু তোমাদের বুঝতে হবে কি বলতে চাইছে. Anatomical neck means few of the most important nerves, arteries is to pass from the anatomical neck. That is the anatomical neck. What is surgical neck? Below the anatomical neck, whenever there is any fracture or any surgery, the surgeon used to cut the part of the neck. That is what's called as a surgical neck. Because the surgeon never used to touch the anatomical neck, because that is the area from where all the important structures used to pass, like the nerves, artery, vessels, everything. What the area where there is no that much of important structure, that's what is called as a surgical neck. Normally, this is the portion, it's called as a surgical neck. This is the portion, it's called as a anatomical neck. So this is the anatomical neck, and this is the surgical neck. Done? So you understood the anatomical neck, surgical neck, head. Now in this position, you can see there is two tubercle. দেখো আমি দুটো টিউবারকুলার উপর দুটো আঙ্গুল রেখেছি, একটা উপরের দিকে আর একটা আঙ্গুল দেখো নিচের দিকে. By that the names is given. যদি মুখস্থ করতে চাও মনে রাখতে পারবে না. How to remember? See, one tubercle is bit up and the second one it's bit low. That's how the name is greater and the lesser tubercle. So where is the greater tubercle? কোন আঙ্গুলটা হতে পারে আমার? যে আঙ্গুলটা উপরের দিকে, যে আঙ্গুলটা নিচের দিকে, you can see this is the lesser tubercle. Now you can see there is a groove. এবার দুটো আঙ্গুলের মাঝখানে দেখো, you can see a groove. তুমি হয়তো ভাবছো এত কিছু বানাবার দরকার কি? You don't know a very important structure is to pass in between this groove, and that groove is named as intertubercular groove or intertubercular space. বিভিন্ন বইতে বিভিন্ন নামে আছে, you can tell any of that. Greater আর lesser এর মাঝখানে there is a space that is called as intertubercular space or the groove. Now I told there is an importance. মনটা এদিকে দাও, পরে যদি এসে কাঁদো আমি কিন্তু একটা লাইনও বোঝাবো না. In between there is a groove, that's what is called as a intertubercular groove. ওখান থেকে কেউ একজন বললো, আমি জানলাম না কে বললো কথাটা, কিন্তু একদম পারফেক্টলি একটা ওয়ার্ড বলেছে. Exactly, it is called as a bicipital groove. It's also named as also. নামটার মধ্যেই কিন্তু উত্তরটা আছে. Why it is called as a bicipital groove? এই নামে আমরা সবাই জানি এখানে একটা কিছু আছে. Biceps. And you know the biceps is having a two head, and one head is to pass in this groove like this way. That's the reason why it is called as a bicipital. দেখবে অনেকে জিমে গিয়ে বিরাট এক্সারসাইজ করে, and that if you do beyond of that, that tendon is to pop up and there is a injury in this region. That's what it's called as a bicipital tendinitis. পরে পড়বে তোমরা। So what's the important part you need to remember as of from the first year? There is a two tubercle greater and the lesser. In between there is a space, that is the intertubercular space or the intertubercular groove. In between there is a tendon is to pass. That's what it's called as a long head of the biceps tendon. এই জন্য এখানে এরকম ভাবে একটা গ্রুপ বানিয়ে রেখে দিয়েছে। Think how the bone is engineered in that way. Now what I told, this portion is the neck. Both this is the surgical, this is the anatomical. This is the sac. The last part we will read as of today. This is কি বললাম এইটুকুনি জায়গাটাকে lower end. এবার দেখো both the lower end দুটো দিকে দুটো bony prominence তুমি দেখতে পাচ্ছ। বলতে পারবে এই দুটো জায়গা কোনটা? নিজের হাতে you can palpate these two over your own hand. This called as a epicondyle. Epicondyle. আমাদের হাতেও কিন্তু এই bony prominence গুলো it can be palpated over here. This is one and this is one. These two are the epicondyle. এবার আমি তোমাদের কোশ্চেনটা করব, কোনটা বেশি বেশি পালপেট করতে পারছো বলো তো, মিডিয়াল সাইডটা না ল্যাটারাল সাইডটা? সবাই তাই বলছিল মিডিয়ালটা বেশি পালপেট করতে পারছো। এবার ম্যাচ করো আমি কতটা ঠিক বলেছিলাম না ভুল বলেছিলাম। এটা কোন সাইড বলেছিলাম? লেফট সাইড বোন, বাট মুখটা কোন দিকে? মিডিয়ালি। আমি এই দুটোকে কি বললাম? এপিকন্ডাইল। তার মানে আমার এই বুড়ো আঙুলের দিকে হুইচ এপিকন্ডাইল? আমার এই আঙুলের দিকে কোন এপিকন্ডাইল? ল্যাটারাল। এবার দেখে বলো তো হুইচ এপিকন্ডাইল ইজ মোর প্রমিনেন্ট দ্যান কোনটা দেখতে পাচ্ছ বেশি প্রমিনেন্ট? medial. So that is how again it matches with your body. This is the medial because this is the medial side, this is the lateral. মানে এই যে প্রমিনেন্সটা এইটা দেখো, এই যে জায়গাটা দেখো কতটা বাইরের দিকে, but you see it is the straight. That is how another bony prominence you will come to know. That's the medial epicondyle and this is the lateral epicondyle. Okay, so with this I think we need to end up or else it's making khichdi আর পারবে না। So with the next class we will go in the depth of the another bony prominence and the surface and the borders of this.